concept. So I will first introduce how this session will flow. So many of you who have attended our previous workshop, they know that how basically we first cover a theoretical concept, and then to practice that concept, we have a breakout room activity under the some mentor or facilitator where you will be participating. So the same, there are two breakout room today also. One is for the item selection that you will see, and the other is for the reliability analysis. So I will start with this basic concept of scale development. So as you know that this is a questionnaire development and validation workshop. So basically a questionnaire, like Dr. Nitin was also saying, whenever you plan to conduct a study, you have either what you do, you do the measurement. So any research or any study, the input we say, or the data which we collect, that is on the basis of some measurement. So now what are those measurements? So measurements are also known as the variable because it is not same in one individual. What is there in one individual, there is definitely some other value will be there in the other individual. So a variable is something which is likely to vary, which is likely to be changeable and capable of being varied. And it differs from one person to another person. That's why we call it as a variable. So variable in the case of questionnaire development, there is a term known as construct. So I will be using this term many times from now onwards. Till now we have used variable, but now I will be using this term construct, because basically the tool or the questionnaire which we form, we are trying to measure a construct. So variables are also known as the construct. So in a person, can you tell how many variables a person can have? Like, we think about ourselves. So we have got both type of variable. There is something known as the tangible variable, and there is something known as the intangible variable. So we have uncountable number of variables. Simply by looking, you can say what are the things which we vary: color of eyes, color of hair, skin tone, maybe the height, weight. And then if you come to the biochemical parameter, then there are a lot of variables which vary from one person to the another person. But we don't measure all the variables because it depends on our research question. The research question and the objective drives us to measure those variables. That's why in any research protocol, there is a column that what are the variables in your study which you are going to measure. And then you classify those variables also, like independent, dependent, and maybe the categorical. And there are so many classifications of variable. I'm not going into the detail, but there are so many variables, but we count and measure only those variables which are related to our research question or maybe the objective. So few variables and construct, if I mention, like this age, gender, weight. Then again, if you see the other side, health, measurement of health. So do you think that measurement of health, is it an easy task? How healthy a person is? Again, quality of life, attitude of a person. These days, we are measuring empathy in medical students. With the incoming this NMC, this ATCOM module that where we have to teach them the attitude, ethics, and communication. If you have to measure a communication skill of a student, if you have to measure a empathy in doctors, how are you going to measure that? So now there is a task to you people. There are 4 variables listed here. Okay, you can see there is a pain, and there's a height, blood pressure, and the SpO2. So which one is the odd among these 4 two? So Martina, Nirmal, Sinduri, Rajesh, yes, pain. And immediately that thing clicked to your mind without thinking that pain is different from the other 3, because other 3 is the basis of your answer must be that it is more objective. You can measure, but pain, there is no tool in the sense there is no instrument where I can go and see that what is the amount of pain the person is feeling. Agree. Then coming to this against question, you have to find the odd in these 4 variables. So you can see there's a cleanliness, surgical site infection rate, amount of biomedical waste generated, and maybe this use of surgical gloves.
Cleanliness of hospital.
Yes, Dr. Anil, very true. Cleanliness of hospital. Because cleanliness, again, you will see that it is although everything is a construct, but cleanliness, you cannot define it very easily like you define the surgical site infection amount and the gloves used. Again, coming to these 4 variables, which is the odd in this case: depression, patient satisfaction, burnt out among doctors, and vitamin D level.
Vitamin D.
Yes, very true. Vitamin D, because vitamin D is very tangible. You can just take the blood sample and measure it. But the other, like patient satisfaction from a hospital, burnout among doctors, that is not that easy to measure. So basically, whatever answer you gave in all these 3 questions, what was the rationale of your answer? So basically, rationale are that there is something known as the tangible or the objective, which you can measure very easily, and we have been doing it. And there is something known as the intangible, which are not so easy to measure. So can you write in healthcare setting, what are the other construct or what are the other variable which are not very easy to measure? Yes, all of you, please write in the chat box. I just want to see what all, like we have talked about few like communication, empathy, burnout, satisfaction, physical activity, yes, professionalism, very true, motivation, how to measure motivation about study, perception, maybe perception of something, yes, leadership skill, very true, Preeti, leadership skill again, not easy to measure. Then again, trust, attitude, quality of life, abuse, communication, attitude, thinking, agree. So you can imagine about the construct. You can, again, there is one important thing, that construct which you have to define: emotional intelligence, brainstorming. Yes, emotional intelligence, very important these days. In doctors also, now there is a tool, and we have seen few projects where they were measuring the emotional intelligence or emotional quotient in doctors, likes and dislikes in doctor. Okay. So agree, these are the few construct. Again, if you see this attitude for blood donation, you will see that many times we invite people, but not everyone come for this blood donation. So what is the attitude of blood donation? Job satisfaction. Maybe if you can ask from any person, and he or she, mostly you will find that he is not satisfied with the job. How to measure that? Again, many of you have said the quality of life. Academic pressure in students, how they perceive the academic pressure. So seeing all these, like you have, Amruta is writing learning skill, Rajshri is writing patient-doctor relationship. So all of you have written so many variables, and you will see that most of these variables are the intangible variables. So tangible variable is something which is very easy and objective. An intangible variable is something which is not so easy to measure. So in a hospital, if you have got, like, there are 3 variables: number of ultrasound machine, cleanliness of a hospital, and suicidal intent at workplace. So how are you going to say, like, which is a tangible and which one is an intangible? Or maybe in the degree, the most tangible, first is tangible, yes, number of ultrasound machine, cleanliness is hospital, ultrasound is tangible, yes, true. Cleanliness and suicidal intangible, yes. And if you see the cleanliness ranks middle, yes, agree, because if you see, and then suicidal intent, that is again very difficult to measure. That if a student comes, you will see that these days students, whether they are preparing or whether they come to the medical college or even the patient, like in all those institute like Kota and Delhi, where the students are preparing, you must have been hearing a lot of news regarding the suicide. So the suicidal intent at workplace, it is also not very easy to measure. And Pallavi is writing level of acceptance for a healthcare center. Yes, maybe the health-seeking behavior, very difficult to measure. I mean, you can say like tool regarding the health-seeking behavior, and it will differ in the different setting. So all these, you can say that there is a shade of the tangible and the intangible. Rajesh is writing stigma is intangible. Agree. So there are a few more in the list. If you see the tangible variable, equipment, computers, furniture, building, garden, etc. will be tangible. And if you see attitude, ethics, communication, satisfaction, and many more which you have written, anxiety, those are the intangible. So then what is a construct? We have talked about that in scale development, we generally use the term construct instead of variable. So a construct is again an indicator variable that measures a characteristics or a trait. So basically it's a variable, and but it measures a trait or a characteristics. So if you see this, what are the constructs in this slide? Yes, all of you please write. Anxiety, self-esteem, satisfaction, patient satisfaction, gender, depression, patient satisfaction, marital status. Yes, that too is a cleanliness. Agree. So ultimately, okay, yes. So ultimately, if you see, everything is a construct here. But construct means like any variable. There are some directly measurable and there are some indirectly measurable. If you see age, height, and gender, they are the directly measurable. And if you see the ethnicity, socioeconomic status, quality of life, depression, happiness, and anxiety, they are, yes, Pavni is writing everything. Agree. Amreen is also writing everything. Indirectly measurable construct. So we have been in, habit of taking BP. Have you ever thought the blood pressure which we are taking, is it a accurate, means is it directly measuring the blood pressure? It is the mercury column which we are seeing. Yes, all of you please write in the chat box. What do you observe? You see the mercury, and maybe these days we don't use the mercury, and maybe that dial this thing where it is pointing. So BP, if you say blood pressure is a construct, but the column of mercury, that is a variable or a item. Yes, Ankita is writing Korotkov sounds. Yes, you listen that, but listen that and then see the measure or the column. So that blood pressure is a construct, but whatever we are measuring, that is a variable. So it is not, ideally we say that you have to insert something inside the artery to measure that. But again, how you're going to measure? It will be with the flow, and you are trying to that using the biophysics formula, you will measure the blood pressure. So there are ways to measure that. So construct is the blood pressure, and then the column of mercury is the variable. Yes. So BP is a non-observable variable, and the mercury height is a observable variable. Similarly, you can think regarding the other construct, but in this case, since the mercury height is very closely predicting or very closely telling you the blood pressure, so we say that error is very less. And we will talk about error as we go ahead in the sessions. So mercury height is very much near to that blood pressure measurement, which is a unobservable variable. Okay, so just imagine that BP, what we think, that is not observable. It's the mercury column, which is the observable, and maybe the Korotkov sound, that's a way which we hear, and then the systolic and diastolic we say. So then if I say this statement that the painless killing of a patient suffering from an incurable and painful disease or an irreversible coma, What do you say? What thing comes to your mind if you see this? Yes, Dr. Ankita is right. It is euthanasia. So whenever you see this sentence, the term comes as euthanasia. How that construct, how you have perceived that? So yes, because you have been reading in your mental frame, your psychological domain, know this fact that this statement pertains to the euthanasia or the mercy killing. Now, if I write this sentence, then what will you say? The formal union of a man and a woman, typically recognized by law, by which they become husband and wife. Yes, marriage. Again, think of a situation when this term was firstly coined, marriage, because if you go back to the history and then trace this term, the thing which are very much acceptable to all of us these days, it has its root. The term that marriage, how it has been coined and what was the basis of that, because initially there was no concept of a marriage, then it later developed. So this we call it as a marriage. So all these are the construct in our psychological domain, and we refer these constructs as a mental abstractions. Mental abstractions, why? Because we always think and we always have seen that these are not directly observable. So it's the mental abstractions. So just remember that these mental abstractions, there are so many individuals, and with the help of a tool, you are trying to, or with the help of an item, you are trying to gauze into that mental abstraction that you cannot do without the involvement of a subject. So we cannot directly observe. If the person is in depression, yes, we can say that the person is in low mood and if he's not talking, but there can be a person who doesn't like to talk. Maybe he's not in a depression, but he speaks very less. He's not that, you can say, extrovert or going and talking to people, but he's not a depressed person. So just by observing the signs, like a person who is not talking and wants to be within herself, you cannot say that that person is suffering from depression. So that's how you need a tool. Tool means there are many items, and if the person scores high on that item, then only you can say that the person is suffering from the depression. So some other signs I like that if the person cries, engages in self-harm, and maybe has got a mood swings, and there are so many. Similarly, you can say that the constructs are not very pinpointing. It's not like with the one item or two item, you can say that I will measure this. So constructs are very broad and abstract in nature. That's why the conceptual clarity of construct is very important. And we'll see the measurement scale also because you need to identify what is the nature of your construct. So some construct can be very easy to understand. Like we have discussed age, gender, ethnicity. If you ask about age and gender, that is easy, but ethnicities, again, it will take a little more thought process to explain what is ethnicity. But like ageism, racism, self-esteem, that are more difficult and complex to explain. Again, we always talk of gender versus sex as a construct. What is a gender and what is a sex? So we know that sex is a biological this thing like male or female, but gender is the acquired role. So a male can have a gender role of a female and vice versa. So construct can have more than one meaning, and you have to tell the respondent what do you mean by the construct. So we will use the term, I said in the beginning only that we will use this term construct and variable interchangeably. Construct, if I ask about the construct, they are conceptualized at the theoretical plane. Theoretical means like in the psychological domain, but those variables, they are operational one, and they are measured and they are empirical. Empirical means you derive that from the data, observed data. So construct, like if you can take the example of blood pressure and mercury. So blood pressure is a construct and mercury is a variable, which is a and the correct constant, it is the operationalized. I have given the operational definition that if the value of the mercury column, it starts appearing, the sound starts appearing at 120, I'll call it as a systolic, and if it disappear, then I will call it as a diastolic. So there are two parts of a construct. One is the construct which are conceptualized at the theoretical level in the psychological domain, and the other is what is the operational one. So operational definition of that variable is very important, because that is the thing which we are going to measure. Like intelligence is a construct, but how we measure it? We measure it by the IQ score. Similarly, weight is a construct. How we measure it? Maybe in kg and pound. Depression is a construct. We measure the Beck's depression score or the DAS score. That is again scale to measure that. So that is a variable. So till now, am I making myself clear to you? Although we have not gone far, but still the definition, the tangible versus intangible variable, construct versus the operational variable. Okay, so Ankita is writing yes.
Yes.
Okay, thank you, Pallavi and Ankita and all Preeti. So how do we measure the construct and how we convert something abstract into a concrete one? So that's our basic aim. So what to do in such cases? I have something like you have also written so many constructs, but I don't know how to measure that. So we have to observe few variables or few relevant items to measure that, and either we observe directly or we observe indirectly. So that depends on our research questions. So like in this case, abstract variable, like if you take the example of spouse love. How do you measure the spouse love? So if I ask this question, how many times your partner hugs you in a day? Then this is a direct measurement, because I can see, you can tell directly that single, like none in a day, or maybe 2 times or once in a day. So that is a spouse love, but that is a direct measurement. If I ask this question about the frequency of headache, how many times you feel headache in a month? Maybe if I'm taking this item as a measurement of depression, then again, this is a type of direct measurement, because the answer will be direct. Okay, Shruti is saying, how many jewelry item purchased? Yes, agree. All women, they always say that the number of jewelry their husbands gift to them, that shows the spousal love. Very true. And then hospital cleanliness. So hospital cleanliness, if I ask about anxiety. So anxiety is like rate your level of anxiety on a 10-point scale. Definitely, this is not a direct question. Because if you ask this question from a person who is suffering from anxiety, he has not thought of it initially. So he will also think that should I write a 5-point or 6-point or 7-point? So those Likert scale are not that easy to answer. Have you ever tried answering questions on Likert item? Because these days, many times you will receive a Google form link, or maybe you have received that yesterday also regarding your personality. So how was your experience in answering those questions? Was it easy or? Yes, because you have not thought of it initially. Tricky, very right. So, and we all are, professionals. So think of a patient. Yes, it needed some thought. It was not very straightforward. So agree. That's why we say that Likert item, although if you say we'll talk these points later also, but when something is asked to you, because those are not a tangible one. So if it is different from saying that how many times you have a headache, that is very tangible one. But answering those questions, do you agree or agree to again somewhat agree or very much agree? Internal cross-check. Agree. Very, very true. And that too, those were the 50 items, I guess, 50 items. So it must have taken time also for you to respond, think, introspect, cross-check, and all those things. So yeah, that was an indirect way of saying. And then the hospital cleanliness. Again, this is a direct measurement. If I have to go and see number of dustbin or biomedical waste bins are kept or not, number of times loo or a washroom is getting cleaned, or the waste generated is going out and maybe measured or maybe segregated. So a lot of things are there which are directly measurable. Again, the patient satisfaction. If you have to write on a 5-point scale, again, it needs a lot of introspection and thinking process goes in our mind before we click one thing, and this is the indirect type of measurement. So you know now what is a direct and what is an indirect type of measurement. So now, if I have to measure personality, like that tool is already there, which we have given to you. But do you think that if we give single item, you can measure that? Like for BP, for blood pressure, you only measure it with the sphygmomanometer and you have that. But regarding something like maybe patient satisfaction or maybe personality traits or maybe empathy and job satisfaction, can you think that if you give one question, then will you get it? Answer. So Pamni is writing no. Rajesh, Martina, no. Kainath, Nishant, yes, agree. Shruti, Anuja, it is not possible at all that you need more than one. Yes, definitely, to measure those constructs. So initially you will say any scale. We have a lot of items. If you take the example of WHO QL, initially it was 100 items and then it got reduced. Similarly, whenever a scale is devised, initially it has got many items, and then with the field testing and more of the expert view, generally we tend to reduce that scale. So if we need multiple items, and that can range maybe 10 to 100, depending on the nature of abstract. Like I was saying regarding quality of life, it has got initially 100 questions. The personality testing, which we gave you yesterday, again, that was 50 items. So those need multiple items, and maybe depending on the domain also. Domain, we'll talk about those domain. I'm not going into that detail. So Pavni's writing, it has to be based on the situation and circumstances. Agree. So suppose you have finally 20 items to measure your abstract variable. And we'll see the steps, how do we frame that. But whenever you have to make an item, you take expert opinion in framing items. And what are those expert opinion? What are the ways to take those opinion? We'll discuss that also. Excuse me. So it may be possible that the different items which we have taken, that are measuring the different domain of your abstract variable, because you get, how do you take? There is a expert committee and you call like a theorist, a psychologist, maybe related to your research question. And then you take patients and you take clinicians also, you take research scholars who are working in the field, and then you do the literature review also, and then you decide about the items. But you are not sure that whether they are measuring a single domain or whether they are measuring the different domains of the abstract variable. So in that case, if you see this, you can see the construct is like love, but love has got more than one dimension. In this case, the care for spouse is also love. The respect is also a form of love. The faith is also a form of love. So it is not a single dimension. You can divide it like a care, respect, faith. Similarly, depression. Depression can also be divided into like depression maybe in the daily activity or maybe in the professional life. If you come to see this domain of the hospital cleanliness, then maybe the staff attitude, biomedical waste management, staff training, that is again a type of the cleanliness, and it is measuring the hospital cleanliness. So these all are the domains. So it depends on the objective. Okay, Pallavi is writing, depends on the objective. Yes. So then you can see, so do you agree that for measuring the same abstract variable, the different researcher may have different type of items and different number of items? That if I think that if I have to measure depression, maybe I can use, there are many tools which are there. There's a Beck depression inventory. There is a DSM-4, DSM-5, then there is a PHQ-9. So I have got different type of items and scales. So then what to do? So if I wish to measure a patient satisfaction of a hospital X, and I have gone through the hospital records to get the patient satisfaction item. So I'm checking for the items. So I am checking the items which are related to the hospital cleanliness. And I have decided to use these items to develop a scale to measure the patient satisfaction level. So is this approach justified? You have to write yes or no. So through the data, I have developed a scale. Many a time you will see that in literature, through the secondary data also, the people they tend to develop a scale. Is it a right approach? So answer mostly is no. So we can say that this approach, this should be mixed with the expert review and the patient interview also. So you can start from this like initial hypothesis generation can be through the records, but if you have to see the final
Smart Hub, 3 items home.
So if you have to see the final tool, then this approach is not justified at all. So I was also reading one book, and we saw that the author, what he did, he had to develop a social support scale. So what he did that he took the marital status and the spouse and the time spent with the spouse as a proxy of social support. But later the review has revealed that that was a wrong attribution of that construct, because marital status can never indicate the social support. Social support is basically a perception. Even if I have in-laws in my house, and even if you cannot say that if the women, social support, let's take for example a working woman. So if a working woman, if you have 3-4 indicators of social support, like maybe you can say that there is a maid at home, not maid, maybe there is a in-laws at home, and then husband also gives time and maybe takes the some share of the work, then can you say that that social support is there? So no, basically social support is the perception of that woman, whether she is receiving that support from the people who are there at home or not. Just if we label that if persons are there at home, we cannot say that the social support is there. So this approach, like telling that the marital status and the spousal time spent with the female gives you the social support, is not correct. So basically these domains, these are the perception of the individual, whether he's getting social support or not. Maybe satisfaction, patient satisfaction level. There can be a patient who's very satisfied coming to the AIIMS, and another patient is highly unsatisfied. So hospital